child protection programs with Unicef and Save the Children. He has been involved in advocacy that led to improved protection of children from sexual exploitation and abuse in humanitarian settings, reduced recruitment and use of children by armed forces, and increased access of children to identity documents and birth certificates and social assistance. Mr. Williams represents UNICEF on the advisory board of We Protect Global Alliance to End Child Sexual Exploitation Online, ID for Africa, CPC Learning Network, and Changing the Way We Care. Mr. Williams, we're very honored to have you. The floor is yours. Thank you.
Thank you very much. Let me put up my slide. I hope you can see the slide.
Yes, thank you. If you would like to put it on presentation mode.
Yep. Okay. Okay. Thanks. I think we're on presentation mode now, isn't it?
Yes, thank you.
Right. So thank you very much, actually. And it's an honor to be here today, actually, to talk about how we can engage governments, actually, to build child and adolescent behavioral health policies in Sub-Saharan Africa. And it's interesting because I've spent most of my time in working in Sub-Saharan Africa. Let me move on with the presentation. At least 1 in 7 children in Sub-Saharan Africa struggle with a serious mental health issue. In most African countries, there is less than 1 child psychiatrist to 4 million people. As you know, I came from Sierra Leone, actually, and in my young years, I used to know the 2 psychiatrists that were there in my country. Only 6% of African countries have child and adolescent mental health policies or legislation. Only 6%. In Sub-Saharan Africa, high rates of poverty, violence, and inadequate mental health systems exacerbate the prevalence of serious mental health needs, and it impairs adequate responses. Rigorous research in the Sub-Saharan Africa region has illustrated significant child and adolescent mental health concerns, yet governments have not been able to invest the required resources to meet the growing needs. I had the privilege of listening to some of the presentation and the debates around some of the research you were doing. Now, let us look at the years lived with disability, because why is mental health and psychosocial support important in Africa? Depression is one of the leading causes of disability. And when we look at disability-adjusted life years, mental health is second in the ranking. Additionally, people with severe mental health conditions die prematurely, as much as 2 decades early, due to preventable physical condition. Mental health as a facet of inclusion should be a priority. Do governments in Africa, Sub-Saharan Africa, are they aware of it? Specific to children, this requires even more attention for children. Mental health and substance use disorder are the leading cause of disability in children and youth, accounting for a quarter of all years lived with disability. 1 in 4 children lives with a parent who has a mental disorder, and most mental health conditions start before the age of 15. Add to this fact that suicide is the 3rd leading cause of death amongst 15 to 29 years old. It puts a very dear point on the life-saving importance of including mental health in the humanitarian agenda and the way we respond. But let's look at the funding gap. There's a substantial gap between the need for mental health services and the funds government have historically put forward to address the need. I heard somebody saying to the mayor in Masaka, there should be a budget line. You check the budget lines for government in Africa, right? You would see that actually it is minimal. So there's a growing body of evidence that's showing that, including mental health across sectors, you can improve the outcome of those sectors, the health, the education sectors, etc. And any mental health condition can be effectively treated at a relatively low cost. Yet, despite the evidence, the gap between people needing care and those with access to care remains substantial, as does the funding gaps, as you can see from the slide I have on. So, the importance of mental health across the lifespan, including to show government how this will help them to achieve their long-term goal. Mental health must be understood along the life course, every stage of life, from the period around pregnancy to early childhood to the first decade, the first 10 years of life, onto the adolescent and the second decade offers unique moments when mental health can be supported, when it may be at risk. Acting early in the life course to address risk factor, and this translates to the prevention of mental health problems later in life, improve health capital and potential benefit for the next generation. Now, let me just give a few messages. If I was talking to the government today, right, what would I be saying to the government officials? If I was talking to the Minister of Finance or the Minister of Health, why government should follow the approach of integrating mental health and psychosocial support. As the response to COVID-19 continues in different ways across region, it is important to take a holistic approach to elevating mental health and psychosocial response. One, a multi-sectorial approach to promote, protect, and care for mental health is important. It underlined the nurturing environment for children when requesting all national response plan. I'm sure you're aware that all countries have a national response plan to COVID. It has to include mental health and psychosocial support across the different sectors. So it has to be multi-sectorial. Two, widespread availability of emergency mental health and psychosocial support is critical. We need to emphasize investing in remote capabilities like quality assures telecounseling. I had some conversation about it when I joined. Three, government to support recovery from COVID-19 by building mental health services for the future. You should not only look at what we do now, but how do we include community workers amongst the human resources with the capacity to deliver on this vision. For us, in terms of our advocacy, we're going to launch a 4-year global advocacy strategy on mental health, which will incorporate ending abuse and neglect as the major drivers of poor mental health outcomes for children and adolescents. And we will focus on 4 main accelerators. We want to secure quality investment in mental health services for children and adolescents and their families across all sectors and settings. Emergency, non-emergency setting, right? Crisis setting, non-crisis setting. 2, early prevention and promotion in the homes through supporting parents. We have seen during COVID how important it is to support parents. And I had you having a conversation around that when I joined. 3, response in the schools and community with promotive, protective, and responsive mental health support in schools. When the school reopen again, right, we should ensure that this is built into the response in making the school a better place for children when they reopen. 4, changing the public conversation on mental health through tackling stigma and discrimination. We know the stigma in Africa. We need to tackle those stigma. We need to tackle those discrimination. We believe actually these 4 points will be suitable for the low resource settings such as Sub-Saharan Africa. Now I'm coming to the end. One of the things we had said before, okay, right? Sorry. One of the things we had said before actually is that government should broaden across the sector of development and integrate MHPSS, that is mental health and psychosocial, into all areas of development assistance, right? It is not only a health issue. So children's mental health and well-being is affected by how well they are supported by their peers in schools and their schools and their peers, even more broadly, by the economic and political structures of our society. Distribution of wealth has an impact. Yes, by events like disaster, war, community violence, major health emergencies like the current pandemic. Government should promote community level approaches, okay, and the importance of intersectoral impact on mental health. Our framework recognizes the different sectors and entry point for mental health and psychosocial, and a chance to reach children, adolescents, and caregivers most in need. The health sector, right, and primary health care specifically may provide education through school and out of school and offer critical entry points of care for children and caregivers who may otherwise not seek help or be identified as needing more focused or specialized care. Child protection, right? Child protection is critical to restoring and strengthening a range of protective mechanisms to prevent and respond to various forms of abuse and exploitation. Only, I keep repeating, only by integrating mental health and psychosocial across sector, building the capacity of each workforce, will we be able to prevent and address the varying and complex mental health and psychosocial needs of children, adolescents, and the family. It is essential that we ensure government invest to scale up community-based mental health intervention and ensure that they incorporate intersectoral and structural solutions, particularly at this time of global awareness and reckoning of the impact of economic, racial, gender, and political structure on the well-being of children. We have an opportunity to make a change to improve the mental health of the younger generation to come in Sub-Saharan Africa. There are risks associated with not taking this intersectoral approach, which I keep repeating over and over, right? There are risks if we don't do that. And so actually we have to ensure that we address this economic, racial, gendered inequality that will only deepen if we don't use the intersectional approach. And the impact on the youngest and next generation will be difficult to fathom. Including mental health for children and youth in Africa can support equity as well. My last point is my policy ask, okay, right? And this policy ask is to ensure that government increase their investment across the sector, a dedicated workforce, and also to include mental health for children and caregivers in policy across sectors. I'd like to thank the organizers for inviting me and my colleagues in Unicef to do this presentation. Thank you very much.
Thank you, Mr. Williams. We have a couple of questions from the audience. If you have a couple of more minutes to stay with us.
Yes, please go ahead.
One is from Dr. Arvind Bana. He is wondering where UNICEF has been most effective in promoting mental health in low and middle income countries.
That's a very interesting question, actually. In fact, I would say that UNICEF really, we work with governments and all the partners. And actually, we have had some interesting collaboration with civil society in Southern Africa, right? During the HIV/AIDS, we were very prominent actually in mental health and psychosocial. And in fact, there's a forum that we used to participate in. Then we're very strong in the conflict affected countries, in Lebanon, I could go on and naming these conflict countries, in Nigeria, you name any of the conflict countries, we are there working with community-based organization, with civil society organization, with faith-based organization.
Wonderful, thank you. And then we have another question from William. He's saying, looking at the slide on government funding, how does UNICEF engage governments to address this funding gap?
So this is one of the things At first, to be frank, at first we used to work directly with government. We didn't look at the budget implication and fiscal space and all these debates. It is one of the things we have now learned, that we have to talk to government to make the investment. And as I said, to be frank, we're only starting it up now to start having that dialogue with government. Now, there are several donors who are also supporting us to see that government make the right investment on mental health.
Thank you. And I have one last question for you. I know that there are many researchers in our audience who deeply care about the issues that you laid out in your presentation. So what are some of the ways that these researchers can collaborate with UNICEF to provide the scientific evidence for you to further strengthen your advocacy efforts?
So first of all, actually, we're trying to make sure that our advocacy ask is result-driven, and we need to rely on them for the implementation research. So one of my suggestions is for them to reach out to our colleagues at the country office, right? But one of the things we really want is to make sure that the research reflects life situation. It has to be implementation research, okay? And definitely if you engage with the colleagues in the country office, UNICEF has an office in every country in Africa, we will be able to take that up actually and build it in. But I keep repeating, it has to be implementation research. It has to reflect real life.
I see two more questions in the chat, if you don't mind. This question is from Rachel. Most mental health units have been turned into COVID treatment centers. What role has UNICEF played in helping governments prioritize mental health care and better plan for future pandemics?
So one of the things we're doing, I spoke about the National Response Plan. We're helping government actually as part of the UN-wide support for government in their National Response Plan for COVID to make sure that actually we build it into these plans. We're also working with WHO jointly, and then we're working on minimum packages that should be included. During this pandemic, actually, I could send it along so you could post it. We did some guidelines to support government so that they could be able to prioritize mental health as well.
Excellent. And here is the last question from Dr. Abdallah. What role can UNICEF and researchers play to address the role of household chores done by children, which sometimes become the vehicle for physical and emotional abuse of children in Africa?
Sorry, could you repeat that question? And I wanted to say, actually, we're building on the Ebola experience, okay, for the previous question. We're also building on the Ebola experience. So it's not only in the pandemic, this current pandemic, that we have the experience.
Okay, thank you. So this question was, what role can UNICEF and researchers play to address the role of household chores done by children, which sometimes become the vehicle for physical and emotional abuse of children in Africa?
That's an excellent question. We are developing a parenting package, and we have seen how the parenting package has made a difference. Another issue is actually caring for the caregivers. We're trying to roll out support, actually MHPS's support for parents as part of this parenting strategy.
Excellent. I see that our audience is becoming really interested. So I keep saying one last question, and then there's another one that pops up, but I promise this will be the last one. One of our audience members is wondering how UNICEF is to what extent and how UNICEF is helping Iraqi children post-ISIS.
Definitely, actually, we are working in Iraq. We do have a very strong mental health and psychosocial program in Iraq, right? But it's not only that, okay? We're looking at education. We're looking at those who were separated from the family, trying to reunify them. We're even working with those who were associated with the groups who were designated as terrorists. So it's comprehensive. We have a comprehensive mental health and psychosocial program actually in Iraq.
Wonderful. So with that, I would like to thank you very much for making the time to join us and for your wonderful presentation. We hope we can stay engaged in our future efforts, and we wish you a wonderful rest of your day. Thank you, Mr. Woolley.
Thank you very much. And I'll send the updated PowerPoint that I used.
Excellent. Thank you so much.
Okay, take care.
You
Bye.
too.